We are back on Morning Line, everyone. Our final segment with malpractice attorney Clint Kelly joining us by Skype. I'm live in the News Channel 5 studios. We're talking about the coronavirus, medical malpractice, the lawsuits that are going to come out of this. If you want to join in the conversation, you can dial us up now. We've got another caller for Clint. Let's go next to Glenn. Glenn, good morning. What's your question or comment?
Hi, good morning. I just started listening to your program, and I have a 90-year-old mother living in independent living, and I had started to prepare her to have food in a room. They have locked them down as far as staying in the room, and they go down, they order their food, and they go down and pick up their food, and they come back to their room for food, and they eat in their room. So there's several things going through my head and how to prepare my mom if something happens in her facility, a virus comes in their facility. One of which I want to ask is, when someone is detected in the facility of having the virus, what is, one, the responsibility of the facility? Will they contact me? They contact my mom and have her contact me? And secondly, several weeks ago, I went in and I purchased a bunch of food and I brought it to her, and I'm about to do that again. And I've been self-isolating at home, so I'm fairly confident 100% that I'm clean or I don't have the virus. I need to bring her a microwave. I need to bring her things so she could be sustained independent of food service in the facility. So there's several things that are going through my head. And the third thing is, we mentioned the signing of contracts and what I've signed away. And I want to know what I need to look into that contract and what my position and the facility's position is.
Excellent questions. And by the way, you're not alone, Glenn. My folks are in the exact same situation. Go ahead, Clint.
Sure. With regard to bringing things into the facility for your mother, different facilities have different protocols for that. Obviously, the risk is, Glenn, you may not be sick, but you may be. I'm not saying you are, but the nursing home doesn't know that, or the facility doesn't know that. So what they're trying to do is take temperatures, follow strict protocols, questionnaires, things like that, to try to minimize contact between family members, the staff, and the residents. So I understand your concern about getting a microwave to her and other items that she needs, there are ways to do that, but I will tell you that, in my judgment, there are going to be stricter protocols for that type of contact in the meantime until there is adequate testing. Now, number two, what are they supposed to do if someone gets infected? Isolate and evacuate, which is what happened at Gallatin. Once you've got somebody who's confirmed sick, you've got to get them out of wherever they are and keep them away from other people. And they're probably going to need a higher level of care, which is why they would be evacuated to a local hospital where they can have access to a respirator in the event that they decompensate. And finally, with regard to the admission agreement, I am willing to bet you, if you look at your admission agreement, buried within there is an arbitration agreement. You may have signed it, you may not have signed it, but you probably did. So once you've signed that arbitration agreement, you have waived your right to bring any claim against that facility in a court of law. You can bring it in arbitration, but not a court of law. If you want to go back and ask to have that agreement vitiated or voided, you have that right, and you can ask them to do that. Whether they agree to do that, that's up to them. But I would encourage you to take a look at those agreements and find out, what did you sign away?
Wow. I'm going to have to do the same thing, Clint. I know we signed an agreement for my folks who are in an assisted living facility, and they're locked down just like Glenn's mother is. And I know we signed something, and I'm sure it's in there. I'm sure it is in there right now. I mean, that's just something people need to check on this. All right, as we sit here now, and this is our final segment, Clint, want to remind folks of this. Obviously, we are knee-deep in this pandemic, and hopefully, a few months from now, things will be getting better. In terms of these types of claims, what do people need to know in terms of reaching out to an attorney?
All right. Well, first of all, to reach me, my number is 615-8000000. That's 800-0000.
We'll put that up too. Yep.
The call's free. The family pays nothing unless I recover money for them. It's a cash recovery. If I don't recover anything, the family pays nothing. So really, they've got nothing to lose. But what I'm hearing from the families, and I hear this all the time, Nick, in medical malpractice cases in general, the patients and the family members, they want answers and they want accountability. Those are the two things they want more than anything else. And I can provide both because I have the tools to engage in discovery. I have experts who can evaluate the care that was provided and provide epidemiological opinions to connect the virus or infection to the facility. And also I can question the people at the facility. A lot of them are corporate employees, so we're talking about corporate America here, to find out why safety precautions were not followed, and more importantly, to make sure it doesn't happen again. So